Hello and welcome to Global Health TV. Today we'll be looking at healthcare under fire in the Ukraine and how to address health disparities in urology. As the war in Ukraine continues, the healthcare system continues to function overall, but spiralling costs, logistical hurdles and damaged infrastructure are making access to essential services all the more challenging for growing numbers of civilians, including those who need access to specialised medicine. At the recent European Bone Marrow Transplantation meeting in Paris, France, I spoke to Dr Bohdan Medvediev from the Kyiv Bone Marrow Transplantation Centre about delivering care in the most difficult of circumstances. Well, first of all, thanks very much indeed for joining us today. Very much appreciate that. Thank you.
Thank you so much too. It's a big honor for me to be here.
So tell us a little bit about your journey. How did you get here?
Yes, I got here by two types of transport. First of all, it was by train from Kyiv to Warsaw. Border guards even don't have my permission to cross the border, and they just told me that I should go away from this train. But finally, they found this document and let me go further. Then we arrived to Warsaw, take the plane, and from Warsaw to Paris without any problems. We got here and it was okay.
Tell us a little bit about what it's been like treating patients this last year in Kyiv.
It was quite difficult, I would say, especially in time of February, March 2022. It was missiles, a lot of missiles in the sky, a lot of explosions, a lot of constant air raids. We were about 15 kilometers far from fighting, and it was like terrible. We have huge problems with medicine, with blood supply, and so on. A lot of donors left our country to another countries and for more safety places in Ukraine. We have no donors to use any platelets. Usually we use ABO compatibility platelets, but in that period of time we use everything we have to.
What about some of the basic challenges like electricity?
We have a diesel generator, so we have no electricity problems. The main problem was, as I already said, medicines, blood supply, and also a little problems with water. It was only 2 days during that period we have no water, but it was resolved very quickly.
What about staff? How difficult is it for you to keep your staff?
I would say that we have also problems with staff because many people lived not in Kyiv, and a lot of our nurses and one of our doctors were under occupation by Russian troops. So we had also big problems with personnel. So we lived in hospital. I even did some work, nursing work and technician works.
Has the global community helped you at all?
Yeah, of course. Global community help for Ukrainian hematology patient network was launched, and with the participation of our Ministry of Health, with EBMT, WBMT, World Health Organization, and so on. And there was some necessary for transplant drugs delivery. Was created EBMT tumor board to help in difficult cases for our patients. And also, if we have no possibility to do the best, we just take our patients to Europe or America, usually to Europe, so they have the best quality of treatment.
What more could the global community do to help?
The main problem, I guess, is medicines. So we don't have medicines for, I would say, for example, for FLT3 positive patients. We have no modern TKIs and so on. So we have some problems, especially with medicine. So if we will get some medicines, it will be cool. Yeah.
We've talked a little bit about how the war affects your work. How has it affected you personally?
For me, the main problem is that I cannot travel and I cannot go abroad for a long period of time to learning, to have some more experience in more experienced centers. It is maybe one of huge problems for me, and we did our best today because we don't even know what will be tomorrow.
Have you experienced shelling yourself?
I heard a lot of explosions. Sometimes it was extremely loud, but everything was okay in our hospital, in my house. Everything is okay. My parents and me and my staff is okay, no problems. So we are continue to work.
So you're working very hard
Yeah.
to provide a good treatment for your patients. Mm-hmm. What effect has the war had on your patients?
The worst problem is in that regions that is fighting now. So south part and east part of Ukraine are affected more, and even those patients who need help cannot go to Kyiv, for example, to have the best quality of treatment in Ukraine.
You've come today or part of the reason for the meeting is the EBMT Nuclear Accident Committee. Why is that an important meeting for you?
It is very important for us nowadays for Ukraine because we don't know what will be tomorrow. Maybe Russian will decide to do some nuclear tactical weapons, and we definitely have to make the plan to evacuate people, to treat victims. So for me, it's very important to go to nuclear accident committee. Also, I should tell that we have also a training program in this committee. So I think it will be helpful for me and for whole Ukraine.
So my final question is, you've come a long way to come to this meeting. My final question is, why come to this meeting? And second is, if you had a message for everybody here, what would it be? I'm working, I wanted to get on EBMT annual meeting for 3 years, and I did it. Now I'm here. So I'm really enjoying and grateful for this meeting, and the key message for all of participants of this meeting, all of Europeans, all of American people, they help us, and I would say. Thanks for helping us and the willingness to help. It's very important for us, and together we're strong. Thank you.
Thank you so much too.
Now to Chicago, Illinois, and the 2023 American Urological Association's annual meeting, where my colleague Dina Baer speaks with Dr. Cheryl Lee from the Ohio State University Comprehensive Cancer Center about how we can overcome existing urologic health disparities and why it's critical that we address these disparities.
Dr. Cheryl Lee is here now from The Ohio State University talking about overcoming some of the health disparities in urologic research. Can you outline what some of those challenges are?
To begin with, our field has had the challenge of health disparities across many of our specialties. In oncology, we're dealing with disparities in outcomes, disparities in the consumption of treatments, and disparities in how patients are counseled even. In the world of female urology, there are disparities related to incontinence. In pediatric urology, there's disparities related to circumcision. So I say this to show that across our field, we're dealing with potential inequities in care, and certainly inequities in outcomes. So one of the ways that we can address disparities is to create research models that can test various hypotheses. This is what we do. Normally, our research is focused on developing new treatments, new paradigms, new strategies, new initiatives, and we have the tools to test those strategies over and over again. Whether we're talking about translational research and looking at animal models or cellular models, whether we're thinking about clinical trials and various phases of study, whether we're thinking about health services research, and we look at numerous administrative data sets and approach those data sets with various statistical models, or whether we're thinking about population health and community-based research, where we're moving from community to community to community to address the questions, concerns, and challenges that individual populations face. So we have a track record of identifying a challenge, creating a fundamental structure to study that challenge, but in an iterative fashion. And now we are struggling with the fact that we don't have those same models to study healthcare disparities.
And what is the impact if we don't address those?
It's more of what we faced for hundreds of years. Poor outcomes in some populations, individuals not being able to reach their full health potential, a lack of health equity. And I think as a society, and certainly as a field, we recognize how critical it is to provide equitable health care.
When you think about the research into new treatments and new care protocols, that has been so critical. But unless you address the inequities, that's going to change things clearly for patients and their healthcare providers. What is the greatest benefit, do you think, to focusing on this as something that is paramount in terms of importance?
Well, as a society, healthcare is very expensive. And being unhealthy relates in a great loss of productivity and a great loss of potential. So it is to our advantage to have a healthy population. My recollection is that soon healthcare will be 23% of our GDP in the coming year. So I think it's incumbent upon all of us, to think about improving the care, the health of our patients. It's interesting when we talk about new drugs being developed, you mentioned that. The vast majority of drugs that are developed are based on important, large, and high-level clinical trials. But there is a very poor lack of representation of many groups in those clinical trials that will actually be the ones, in theory, utilizing those treatments. So we don't know if various populations will react differently to different medications and have different outcomes. We have even faced issues from a research standpoint in clinical trials where trials aren't documenting the race and ethnicity of their patient population. Now, that's getting better in this day and age. but it hasn't always been that way.
So if you had one recommendation to researchers to begin to make an impact when it comes to health disparities, what would it be?
Collaborate and demand the information that's needed for us to look at the situations that may trigger and lead to disparities. Social determinants of health, for example. How do the social determinants impact cellular structure? How does that impact disease and treatment resistance? We need to ask these questions, and we need to create the models, be they cellular models, be they preclinical models, be they approaches to modeling clinical trials with relaxed eligibility criteria, with health system strategies to improve representation, or community-based models to engage patients and understand what they feel is important and what they need. We have to create those models to address the questions that will then hopefully lead us to that iterative process of hypothesis generation, trial and error, and coming up with real strategies to reduce disparities.
Well, Dr. Lee, it's going to be a journey, but you are beginning the process in the right direction.
Thank you.
Next up, Serigne Magueye Gueye, Professor of Urology at the University Cheikh Anta Diop in Dakar, Senegal, has devoted himself to building international networks of physicians and researchers to address some of the most complex urological conditions, including obstetric fistula. He is the recipient of Urology Care Foundation's 2023 Humanitarian Recognition Award. He joins my colleague Dina Baer and Dr. Harris Nagler, President of the Urology Care Foundation, at the 2023 American Urological Association's annual meeting in Chicago, Illinois, to discuss his work.
Dr. Harris Nagler is here now, the president of the Urology Care Foundation, giving out once again the Humanitarian Award. And we have the great pleasure of being joined by this year's recipient, Dr. Serigne Gueye. First of all, congratulations.
Thank you very much.
I want to talk about your work. I want to talk about the award in just a moment. But first, Dr. Nagler, I want to talk about the presidential address and your focus this year.
So our focus is to update the audience on all the activities of the AUA Urology Care Foundation. The Urology Care Foundation is focused on improving healthcare around the world. We are a worldwide organization. And what I'm going to show is what we are doing worldwide to improve healthcare. We believe elimination of disparities is an important part of elevating healthcare worldwide. Dr. Gueye is an excellent example of people who are focused on eliminating healthcare disparities and improving healthcare.
And Doctor, I know you do it out of the goodness of your heart and your expertise, but what does it feel like to be awarded for your work?
I think that's something I didn't expect from the AUA, Urology Care Foundation, and that is the biggest organization in the world, and being recognized by an entity like the Urology Care Foundation is just something that made me feel like I was on the right path, and I really appreciate it. I have a lot of friends in the Americas, urologists who work in Africa and somewhere else, and I think that brought what I do from the other side of the world to the Americas, so it was appreciated, and I really thank you very much, Mr. President.
And I know Dr. Nagler said that it was a unanimous choice for you. I don't want you to be humble now. I want you to tell me about what you do that is so important, that touches so many people.
Well, actually, I never work in my life. I have never done any work since I started working. Actually, I'm living a passion. This goes back from when I decided to become a doctor. It was a personal choice, and that came from a family disaster. Having my dad working, going and coming, and dead in the afternoon without care at the hospital. I was very young. I was about 11 years old. And very early in my high school years, I decided to become a doctor and not telling to anybody. Actually, it's like I'm trying to cure my dad, who had not been privileged to get services when they got to that hospital on that day of July 30th, 1969. And since then, I went to the School of Medicine And hopefully I went to the army. And being in the army brought me everywhere, took me everywhere. And then after that, I became a surgeon, I became a urologist, and I just dedicated some time to serve the underserved and to try to help the needy area, the needy nation throughout Africa to make sure they can get training, they can build capacity, and we can service the poor.
Doing so much good out of sadness. I love that. What was it that impressed you most, Dr. Nagler, about Dr. Gueye? And how do you think meeting him, hearing his story, helps the field of urology?
Well, he epitomizes what a humanitarian is. He does it for the right reasons. All the glory that he's achieved, if you will, is a byproduct of what he does because he believes in it. He never focused on, I'm going to do this so I benefit. He's trying to help people around him and improve healthcare for people, not just his immediate family, but people throughout Africa. He's united many nations and urologists around Africa to focus on improving healthcare. He's educated them. He actually received the United Nations Award for his healthcare efforts in the past as well. So he's an exemplar of the humanitarian initiatives.
And that really does speak to this idea of the disparities in care when you talk about the people that you are serving versus maybe whom you might encounter here in this country.
So we have disparities in healthcare around the world. We recognize that. The Urology Care Foundation is focused on doing what we can to improve that. And we can do it by three ways. We can educate people. We believe that education is an essential part of getting rid of healthcare disparities. We want to make sure that patients have access to materials that allow them to make intelligent decisions, to be participants in their healthcare. We are doing that in now 11 languages so that this is not just a United States effort, but this is a worldwide effort. We want to educate our educators. We want to make sure that we support researchers so that they can learn how to be healthcare providers and, in fact, be the leaders for the future, so we can, again, alleviate the world of disparities. So the third phase of this is our humanitarian work. And our third phase is humanitarian work where we are supporting individuals to go around the world and help do work like Dr. Gueye is doing. Lastly, we have a new initiative that I think is very exciting and important, and that's a healthcare equity fellowship that we're sponsoring. This is a brand new initiative that we're launching this year, and it's a 2-year program. We are going to be educating people to become conversant in the ways of working on healthcare disparities. They are going to get a certificate. They are working with a university to get a certificate in bioethics so that they are better prepared to be the leaders of the future so that we as a society can really move into the future.
Well, gentlemen, you both are making a difference. Thank you for all you do, and thank you for joining me here today.
Thank you very much.
That's all for this episode of Global Health TV. Next time, we'll be looking at diet and mental health, cultural attitudes to psychedelics, and climate change and mental health with experts at the American Psychiatric Association meeting in San Francisco, California. So until then, it's goodbye.